Well, even today, 1/4 of all CRT implants are upgrades from a previous pacemaker or previous ICD, and this is despite evidence to support this practice. Well, we wanted to see, in a broad European perspective, embracing all the 42 ESC countries, meaning Eastern countries, meaning North Africa, how is CRT practiced to date regarding patient characteristics, background medication, what was the quality of the surgical procedure, the complication, and the planned follow-up. And that way we know how you practice the CRT across different countries, across different economies, how you interpret the guidelines, indication, etc. Well, upgraded patients, not surprisingly, were older, 3 years older than the de novo recipients, and there was a larger proportion of them being significantly older, that is above the age of 75. They were less often females. They had more cardiovascular morbidities in terms of previous revascularizations, valvular disease or surgery, and a previous myocardial infarction. Also, their heart failure condition was slightly worse than de novo recipients, meaning more patients were in functional class 3 and 4 compared to de novo, and patients had a higher NT-proBNP and more commonly moderate or severe mitral regurgitation at the time of implant. Well, first of all, our success rate in the implantation, length of stay, fluoroscopy time was similar, and so were complications. That is, those related to the procedure, those post-operative during the hospital stay, and may adverse events. And that means that from a theoretical point of view, you shouldn't be afraid of upgrading patient to a CRT. But the downside of it is that there's really no scientific evidence for doing so, or it's based on observational studies, very small parts in some randomized controlled trials like RAFT and MUSTIC, and those results were basically neutral. So we need a trial, and there is one ongoing, in fact. It's called the Budapest CRT trial, led by Bella Merkley, and what it does, it randomizes patients with the device to be upgraded or not be upgraded to a CRT. That's the way you can do a trial in these patients, and hopefully these results will clarify whether there is an advantage of being upgraded to a CRT if you have a pacemaker or an ICD, or if it's not an advantage, and then you of course shouldn't do anything. So that is what is in the pipeline.